Rancho Los Amigos National Rehabilitation Center is the oldest rehabilitation center in the country. Their physicians have been treating patients for more than 50 years, and believing that rehabilitation is not a static discipline means that this center is once again leading the way with innovative ways to make the rehabilitation process more effective than ever before. I'm your host, Rachel Bozing. Welcome to My County, the show that explores services and programs provided to you by Los Angeles County. Joining me today is Dr. Mindy Aisen, who is the Chief Medical Officer for the Rancho Los Amigos National Rehabilitation Center. This is the oldest rehab center in the country, and LA County residents are really lucky to have an institution with this level of expertise. Tell me about it.
Well, Rancho is unique. Rancho is the longest established rehabilitation center, certainly on the West Coast, and it's the place where most orthopedists, at least of my generation, trained across the country. And our staff comes from all over the country, from Johns Hopkins and Harvard, because of Rancho's reputation. It's in Los Angeles County, but it really serves the whole nation.
That's right. So you've got inpatients that are about 3,600 a year and outpatients that are about 70,000 annually. But let's talk about the spectrum of rehab. There's kind of the lower end rehab, I say that lightly, and then kind of rehab on the extreme end. Can you dimensionalize that for us?
Sure. Rehabilitation can be helping somebody with low back pain. It can be helping somebody with diabetes and difficulty with blood flow to a limb, so limb protection and salvage. And it can be helping a victim of bad trauma, head injury and spinal injury and broken limbs. We take people with a great many different medical and surgical needs and help them get through all of these different kinds of injuries and illnesses.
Now, more than 50% of your patients have suffered some sort of neurological trauma, and rehab, since that's your field of expertise, again, we talked about it's not a static discipline. You're ever evolving in your approach to it. Tell me some of the great ways that you're approaching it these days.
Well, you're right. The majority of our patients have neurological illness or damage, stroke being the most common cause of being admitted to a rehabilitation hospital. Our thinking about rehab has changed tremendously as science has moved forward and shown us that the brain is a learning machine, and even an older, injured brain is a learning machine. And so now we are shaping our rehab to take advantage of new scientific discoveries, giving people very intensive and specific programs to help them regain movement in a limb instead of only, and only is not that minimal, helping them adapt to a new situation. So we do comprehensive rehabilitation, helping people adjust to a new limitation, but also pushing them to regain what they've lost.
Which is really cool in terms of the change in the way of thought. That one was you kind of, if you lost the use of a limb, for example, then that was kind of it forever. You had to make do and kind of work around that. But you're saying the brain can relearn another pathway to get to that usage again.
Right, that's what we're studying and exploring. The traditional way of approaching someone with a stroke was put the weak limb in a sling and teach them to do everything with the other side.
Right.
And that reinforced the weakness of the weak limb. Now, we practically tie up the stronger limb and force them to use the weaker limb, at least for periods of time during the day, so that they can regain use.
And that touches on your intensive therapies that you're talking about, just that repetitive motion perhaps, and also that it needs to be enjoyable. Now, one of the things I found fascinating is that you have a model home. Like, that's one of the new ways you're kind of getting rehab and making it more accessible and a little bit more enjoyable. Talk about what that means.
Well, there are a number of reasons that that's really important. The whole approach to medical care and rehabilitation in particular is changing. Hospitals are not a good place to be. They're not. We want people to return to the community, to return to a fulfilling life.
Right.
And so hospital stays are shortening, not only because of financial constraints, but because of the science behind getting better. The sooner one can return to the community, the sooner people are out of a hospital environment, the better off they are. So we are moving toward an outpatient and even in-home rehabilitation model, and the model home is a good way for people to experiment and practice with being in a home environment instead of a hospital environment, so that they get into the shower, get into a bed, work in a kitchen under supervision supervision from our therapists.
Right, initially, and then when they actually finally do return to their homes, they're able to do it.
Right.
It's not like they're trying to do that task for the first time.
Exactly right.
Outside. That's
Yes.
great. And the other thing that you're doing, or another example, is increasing staying in touch. How is that helping?
Well, technology is a great liberator for people with limited ability to get out of the house. So we stay in touch by email and telephonically, and we're working on ways to get people more active in the home and to track their activity in the home. This is more on the research end of Rancho's activities, but Rancho has a rich research history, and we are researching ways to get people to do home exercise, to monitor them while they're doing home exercise, and to make home exercise enjoyable, as you said, so that they are motivated and will continue to do it and continue to progress after they leave the hospital.
And one of the things that you said that struck me is that you can't just do the motion. The brain has to be engaged.
Yes, this has been studied. If you can put someone in a constant passive motion machine and they're not paying attention, it won't change their physical function. It may get the limb a little more limber, but that's all it will do. But if they are moving their limb and it's purposeful, it's to do something they really want to do, and in this case, when we use the robots, if they're controlling an icon on the screen, it's very enjoyable. They're not even thinking about moving their arm, and they're getting stronger and stronger because they're trying to achieve a task.
Let's touch on that, because rehab, I think that it's hard and not necessarily something that's enjoyable, but you really stress something that's enjoyable and really finding ways to do that.
Yes, it's critical that it is enjoyable, pleasurable, fulfilling, because the brain has to be engaged and the person has to want to do the movement. No pain, no gain. Sometimes it's uncomfortable, but they have to want to do it despite that. So we're working on more elaborate virtual reality programs for the future in conjunction with USC. So that if people are having trouble bearing weight on a painful hip, they're going to be so motivated to do it by the virtual environment that they are going to do it because it's more enjoyable to do that exercise than not do it.
That is fantastic. Can you tell us where people can learn more about it, or perhaps come and find out more about the Rancho organization?
Yes, well, we encourage people to visit our website, which is rancho.org, and our phone number is 562-401-7161, and we encourage the community to come visit us.
Perfect. Dr. Aisen, thank you so much for your time. I appreciate it.
Thank you.
And please join us next time on My County, and here you'll learn more about the programs and services brought to you by Los Angeles County.